Good morning, everyone. It's exciting to be here. My name is Jutas Szvilen Foldvari. I'm the managing director of HealthCare in Central Eastern Europe. And I would like to share a few thoughts on the AI role in the healthcare transformation. I think many of the thoughts will not be a novelty, but I think maybe I can bring a different perspective or to give a summary on where AI development stands in terms of transforming healthcare or contributing to the healthcare transformation. I would like to spend a bit on who is GE HealthCare, who we are. GE HealthCare, we are we say a startup company that has been built on more than 130 years of innovation. Earlier this year, we spun off from GE Corporation and we became a standalone company listed on the NASDAQ, employing more than 50,000 employees worldwide, generating around $20 billion revenue annually, running, maintaining an install base of more than 4 million systems globally, and actually on our systems more than 1 billion patients are being scanned annually. When it comes to our footprint in Eastern Europe, we have more than 1,500 employees in various locations, and we are hosting 2 of the 7 critical sites of GE HealthCare, one in Krakow and one in Budapest, where we employ more than 500 software engineers, digital workforces, working among many other applications also on AI applications that should contribute to the transformation of healthcare. Why to transform healthcare? I think probably today as well, it's been said that the demographic challenges are both creating a huge demand for healthcare services, but also they are impacting the workforce, the healthcare workforce. I mean, only as of today, globally, 7 million healthcare practitioners are missing from the industry, and this is projected to increase by 10 million shortage by 2033, and some prognosis says it's going to reach 14 million healthcare professionals missing the industry by 35. So it's a huge demand with a huge stress on the workforce. We carried out a survey earlier this year to understand how the people in the center of healthcare industry see this transformation. We as both patients and practitioners, and the numbers are sobering, right? I mean, healthcare professionals are on the edge of burnout. They don't feel respected. They are considering changing their career path, and 1/3, they don't feel pride in their profession. When we ask for the patients, there is a lack of trust, and I think the previous presenter mentioned as well the importance of trust in healthcare. Well, large number of patients are lacking trust in the current healthcare system. One of the important findings of the survey that we did is that no matter whether we are as practitioners or patients, they united in one objective, which is that healthcare has to be much more human. Any transformation of the healthcare industry has to serve the patient and the people working in the healthcare industry. Also, from the survey, we've seen that there are, people see 6 trends which are defining the future of the healthcare industry, from the well-being of the care team, from between the partnership of the patients and the healthcare providers, smart and connected technology, the big data. I mean, think of that only this year, in 70 days, the healthcare data has been doubled, right, globally. It's a huge number, right? Huge number of data, and defining what is noise and what is a signal, what is the right data, is going to be a challenge for the system. And also, the way healthcare is being delivered is going to change. More and more need is emerging for distributed healthcare and precision medicine. In order to reach this objective, healthcare to become more human, there are multiple barriers to be tackled where, in our view, AI is playing already a significant role. AI is running at equipment level, right? We can think of algorithms, we can think of image processors which help focusing the healthcare providers on the right thing when they take care of a patient, highlighting critical cases, and reducing biases and errors, which is also a big contributor of the current inefficiencies in the healthcare system. Also, AI is impacting at department level, streamlining the workflows, reducing the waiting lists, reducing the admin time. Today, many of the healthcare practitioners that we asked, they claim that they have little time really to care with the patient. Administration, pushing the workflow, doing the next step is taking up most of their actual working time, whereas the reason why they joined this industry, the human connection, helping others, has been reduced to the smaller portion of their daily work. And when it comes to enterprise level, large data helps creating analytics so that a patient pathway can be improved and new insights can be generated both for preventive healthcare, but also for optimizing the patient experience and creating overall a better clinical output and an overall outcome both for the payers and also for the patients. Going further, going a bit deeper into how the AI tools are impacting already the healthcare system, I would give a few examples, right? I mean, one is computer vision. Computer vision, together with machine learning and deep learning, allows already on portable ultrasound systems at the point of care, the examination to be done to be concluded by a less experienced healthcare professional, right? This is going to be important when we want to increase the access of healthcare, especially to underdeveloped areas. Large language models already are supporting new stuff to tackle all the new publications and all the new information that is being generated in the healthcare industry. According to one study today, a general practitioner would need to spend 21 hours a day to keep up with all the science and new releases of medical field. Imagine, I mean, this is not possible to fathom, right? Also, when it comes to deep learning, with the deep learning, image processing became much more capable for all the practitioners. Today, a radiologist, and I think, do we have radiologists in the room? None? Imagine that a radiologist used to, 10 years ago, was using or looking at 500 images per day in a 12-hour shift. This number is going to 10,000, 15,000 images per day that has to be processed. So without the AI-enabled solutions, this is becoming impossible. And I see my time is over. Maybe I would bring two important elements from GE HealthCare. One is ERCON-DL, which is using these deep learning, machine learning algorithms on MR systems to create better MR images in less scanning time. And from a longitudinal, from a care pathway perspective, IRT is an important milestone. I mean, radiation oncology is a complex area of care where there are multiple modalities working together to create an image, a profile of the patient and create the therapy. We've been introducing a care pathway solution where for the caregivers, they can see all the data in one place together instead of digging and spending a lot of time to find the right answers. Thank you for your attention.